Hello everyone. So though I thought I'd leave this without a video explanation, I think there is a bit of confusion and I thought I should clarify this. So the first question is asking what are the arrows demonstrating. Now what you're seeing here are intermittently spaced cells with clear cytoplasm which looks vacuolated. Nucleus is slightly, see, this is a more vesicle nucleus of a keratinocyte. This is more dense. You can see that the nucleus is much more purple in color. And yeah, the clue is that these are spaced around, around 7 to 8 cells apart. So for every 8 keratinocytes, there's one such cell, and this is basically a melanocyte. Now, quite a few of you have marked this as vacuolar interface change. Now, vacuolar interface change is basically in the context of a vacuolar interface dermatitis. However, this is normal skin. There is no inflammation whatsoever. When there is no inflammation, you cannot call this vacuolar interface change, and neither can you call this satellite cell necrosis. Satellite cell necrosis is when you're seeing an apoptotic keratinocyte, which may look like this, but then the nucleus is much more pycnotic. It's not rounded like this. See, the nucleus is intact. In an apoptotic keratinocyte, the nucleus is shriveled. It looks shriveled and shrunken basically, and much more hyperchromatic. And again surrounded by lymphocytes. All right. So this is a melanocyte. Mast cells don't usually find them in the basal layer, and even if they are, they're sort of fried egg shaped. Now Langerhans cells, I've put this specifically because the next question is about Langerhans cells, and they are found much more higher up in the epidermis. Can look similar, but melanocytes don't occur higher up in the epidermis, and that brings us to the next question. So a Langerhans cell again may look similar, has much more cytoplasm than a keratinocyte. So in the keratinocyte, the cytoplasm is much more pinkish. Here, the cytoplasm is clear. Now, typically, Langerhans cells, we've learned about kidney bean-shaped nucleus, but then that may not be apparent in normal Langerhans cells. Okay, what you're seeing is just this. But the clue is it's spaced higher up in the epidermis in the context of a bit of spongiosis. Yes, there is spongiosis here. This is a case of eczema probably. In eczema, you do see a few more Langerhans cells than usual because they're antigen-presenting cells. Now, why is this not a spongiotic microvesicle? It's not a spongiotic microvesicle because there is not enough inflammation to cause a microvesicle here. There is slight spongiosis, but there's not much inflammation, and this is not a lymphocyte. In the context of lymphocyte, you may think, okay, this is a spongiotic microvesicle, but there should be a lot of lymphocytes there. So why is this not a melanocyte? Melanocytes are not spaced that high up in the epidermis, as simple as that. High apoptotic keratinocyte, again, if it's an apoptotic keratinocyte, the nucleus is much more pycnotic, shrunken. This is a fairly intact nucleus, much more rounded nucleus. Acantholytic keratinocyte, again, you should see the cytoplasm of the keratinocyte. There's no cytoplasm whatsoever. It's just a nucleus surrounded by a vacuolated cytoplasm. Okay. Acantholytic keratinocyte, it will be this big, or at least this big, and the nucleus is vesicular, like in this case, as you can see here in the other nuclei. The character of the nucleus is completely different. Mast cells, again, very rarely you may see them high up in the epidermis, usually not, and again, fried egg shaped appearance. Plasma cell, again, you should see a cartwheel shaped nucleus, which you don't in the cytoplasm, is not that of a plasma cell. Now, the clue again here is what special stain is shown here. And you can see special stains mark these cells here, and quite a few of you have called this melanocyte because I don't know, you thought the special stain. You won't find melanocytes here, and I told you this is basic dermatopathology. The theme is basic dermatopathology. You may find this in a melanoma, but then this is not a melanoma. You can make that out even on low power, that this cannot be a melanoma, right? Melanoma, you see abnormal melanocytes, not single melanocytes scattered about without any nesting or infiltration in other areas. So the stain here for Langerhans cells is CD1A, okay, I won't go into the details of what the other stain, but CD1A is the stain for Langerhans cells. Now, which structures are present in the highest concentration? These structures are present in the highest concentration on this part of the body. Now, you can make out these are sweat glands. Okay. Now, these are sweat ducts. Sweat glands and sweat ducts can be differentiated, and this is a minute point, but I'll tell you anyway. Sweat glands have myoepithelial layer, and because they have to pump the glandular material out, the duct itself does not pump, so the myoepithelial layer is absent in the duct. That's how you remember it. And ducts have cytoplasm which is less in quantity and less eosinophilic. Here you see a much more eosinophilic cytoplasm in the lining of the glands. Okay, so these are sweat glands and sweat ducts. Now, where do you find them in the highest? Obviously, palms and soles, and that's your answer. Palms is the answer. I don't think I need to go into the further explanation. So, this is a biopsy of a 60-year-old male with a small 5 mm sized skin colored papule in the nose since 2 years. And what is the diagnosis? Obviously, what you can see here is lots of sebaceous glands. Okay. Now, when you see lots of sebaceous glands, and you think about a sebaceous neoplasm, but then the differential here for sebaceous lesions are nevus sebaceous and sebaceous hyperplasia. Now, the history is a clue. 60-year-old male, 5 mm sized lesion for 2 years, not a sebaceous nevus. This is sebaceous hyperplasia. This is not a BCC because you don't see a baseloid tumor. This is not nevus cutaneous lipomatosis superficialis because A, the site is all wrong, usually occur on the buttock areas, and 2, this is not adipose tissue. This is sebaceous gland. Which part of the body has the highest concentration of these glands? Now, these are the clue to what these glands are. These are not sweat glands. These are apocrine glands. Apocrine glands because you're seeing this apocrine secretion. Okay, apocrine glands are largest in the axillae. All right, that is the clue. They're not common. They're not present on the palms and soles usually. They are present in the axillae. That's where you have the highest concentration. All right, but the clue is to find the decapitation secretion. This is all the decapitation secretion. You can see that here as well, and this is a clue to this being an apocrine gland. All right, thank you very much.